Almost everybody knows of someone or they themselves have directly been impacted by the big C. That's right, I am talking about cancer. But how many of these people are or were affected under the age of 18? Childhood cancer is a very scary reality for far too many people. Unfortunately, my family has been impacted just in these past couple months due to my 14-year-old cousin being diagnosed with acute lymphoblastic leukemia. The Children's Hospital of Omaha pronounces leukemia as the most common form of cancer in children. I am not the one diagnosed. No one in my immediate family was diagnosed either. But cancer does not just affect the patient, it affects everyone around them in a variety of ways. In just over 20 to 30 years, those who are younger in age have been given a real fighting chance to beat acute lymphoblastic leukemia, or otherwise known as ALL. Today, I will inform you about the effects, the treatments, and the prognosis for those battling the terrible disease that is ALL. To begin, let's start off by defining this disease and looking into the effects of a diagnosis. According to the Leukemia Research Foundation, acute lymphoblastic leukemia is the most common type in young children and accounts for 5,000 new cases a year. First, let us begin by gaining an understanding of what ALL is. The National Cancer Institute defines ALL as a cancer in which the bone marrow makes too many immature lymphocytes, a kind of white blood cell. Leukemia can affect the red and white blood cells along with the platelets in the blood. Red blood cells transport oxygen and other vital substances to the tissue of the body. Platelets are used to stop bleeding by building blood clots, and white blood cells fight off infection or illness. This cancer, like others, only gets worse if not treated. Diagnosis is acquired from tests that examine the blood and bone marrow. Now on to what might occur once someone is diagnosed. St. Jude's Hospital lists possible symptoms of ALL, which includes fever, easy bruising, bleeding that can be hard to stop, weakness or fatigue, paleness, and shortness of breath. The leukemic cells taking over the blood system cause all of these symptoms, and that's just the short list. The leukemia isn't the only thing that affects a patient's body either. Treatments, specifically chemotherapy, have side effects of their own. These common side effects listed by the American Cancer Society range from nausea and vomiting to mouth sores to weight change. The signature side effect, however, is balding or hair loss. Cancer Research UK offers that the treatment that saves these patients' lives can also bring some long-term side effects. These include fatigue, harder to fight off infection, infertility, heart problems, and a few others. On the topics of treatments, I'll continue by discussing the range of procedures and medications used to fight and end this terror. All patients diagnosed with cancer who choose to go through treatments have a plan that can involve several different processes to rid themselves of the mutated cells. As with most cancer cases, chemotherapy will be a main part of treatments for most all patients with acute lymphoblastic leukemia. The National Marrow Donor Program states, chemotherapy is a treatment that uses a group of medicines that destroy cancer cells or stop them from growing. The program continues to mention that there are 3 phases of this treatment: induction, consolidation, and maintenance. Many receive intrathecal chemotherapy as well. Induction chemotherapy is given with the goal to bring about remission and is oftentimes intense, which means it usually results in a month-long hospital stay. Consolidation is just as intense and consists of several months of treatments occurring monthly. This therapy is aimed to lower the leukemic cells left after the first remission. Maintenance therapy occurs if a patient is still in remission after the first two phases. While this phase's goal is to destroy all disease cells left over so they are completely gone, this process can last over several years. During all three phases, some patients can receive intrathecal chemotherapy, which is to destroy cancerous cells that may be in the central nervous system, by injecting the treatment directly into the fluid surrounding either the brain and/or spinal cord. Unfortunately, not all patients go into remission, or they relapse and must seek other treatment plans. Relapsed ALL in children has been known to come back in the blood and marrow, nervous system, testicles, and other parts of the body. The secondary options to end what came back includes bone marrow transplants. The National Marrow Donor Program defines a bone marrow transplant or cord blood transplant as a process to replace the unhealthy marrow with healthy bone marrow. One type of transplant is an autologous transplant, in which it uses your own cells that were collected from your own bloodstream. The other option is an allogeneic transplant that uses a donor cell, such as a family member, unknown stranger, or umbilical cord unit. This kind of transplant is what most of us think of. Anti-cancer treatments can also include immunotherapy and small molecule therapies. Immunotherapy marks cancer cells through the use of special proteins called antibodies for the immune system to destroy. These treatments are suspected to have fewer toxins and side effects than chemo. Small molecule therapies disrupt the cell's functions from the inside. When an important activity is blocked by this therapy, the cell will eventually quit, then die. Radiation therapy and blood transfusions are also treatments for blood-related cancers like leukemia. Treatments are what give a patient a fighting chance against the prognosis against them. While cancer is a very terrible thing, the prognosis for ALL can give some patients hope for a good outcome. With all the research of the disease and advancements in treatments, the 5-year survival rate since 1960 has quadrupled according to the Leukemia and Lymphoma Society. From 2005 to 2011, the overall 5-year survival rate was about 70%. This is one of the highest survival rates compared to other types of leukemia. The percentage was about 92% survival for patients younger than 15 and about 93% for those younger than 5. However, the Leukemia and Lymphoma Society unfortunately expect 24,400 deaths in 2016 due to all types of leukemia. The National Cancer Institute lists factors that can affect the possibility of recovery. These include age of diagnosis, what cells the leukemia began from, whether the child has Down syndrome, if leukemic cells were found in the nervous system, and weight at diagnosis. Remission is defined by the American Cancer Society as having no evidence of leukemia after 4 to 6 weeks of induction treatment. This includes the following factors: if there are 5% or less blood cells in the bone marrow, cancer blood cells in the bone marrow, blood cell counts are normal, symptoms of the disease have ceased or are no longer present. Molecular complete remission means that even with sensitive lab tests, there's no cancer cells to be found. Minimal residual disease signifies that while under simple lab tests, such as looking under a microscope, the cancer cells are gone, when using a more sensitive lab test, there are still signs of the cancer. Remission does not always mean cured. However, St. Jude suggests that after 10 years of remission, one is thought to be cured of cancer. For children, the Mayo Clinic believes that the treatments have a great chance to result in a cure. Along with that, the University of Maryland Medical Center states that acute lymphoblastic leukemia can be a curable cancer, and the rate of survival is now at a high. It seems to be clear that this disease affects many people in a variety of ways, has a wide range of treatment plans, and the prognosis could be viewed as encouraging. I am hopeful that you took an interest in this terrible disease, and perhaps you will look into what you can do to help these patients, such as donating blood or even becoming a bone marrow donor. Thank you.